friends. Now let us learn about extrahepatic biliary apparatus. Extrahepatic biliary apparatus. Let us first learn about extrahepatic biliary apparatus. So extrahepatic biliary apparatus, it is nothing but all those organs or all those tissues, all those ducts which receives bile from the liver. These extrahepatic biliary apparatus, this receives bile from the liver and then it sends it to the gallbladder and concentrates the bile in the gallbladder, and then the concentrated part is then transferred into the duodenum. All this apparatus which is required for the transfer of bile, concentration of bile and storage of bile is extrahepatic biliary apparatus. So what is the extrahepatic biliary apparatus consists? See, extrahepatic biliary apparatus consists of right and left hepatic duct. What are these both? Right and left hepatic ducts. Okay, right and left hepatic duct combine together to form a common hepatic duct. This common hepatic duct, okay, now this is, what is it? You can easily guess it, gallbladder. The gallbladder, the bile that the gallbladder receives is from the cystic duct, okay, and then it even concentrates the bile and then sends the bile to the cystic duct. So this is cystic duct, serious cystic duct. Okay. Now the cystic duct combines with common hepatic duct to form bile duct. Okay. Cystic duct combines with common hepatic duct to form bile duct or common bile duct. This common bile duct now combines with this pancreatic duct to form, what is it? Major pancreatic, pancreatico-hepatic duct, and this pancreatico-hepatic duct opens into the duodenum. Okay, while it is opening into the duodenum, now you will be having three sphincters. One sphincter which surrounds the bile duct, and this is called as sphincter choledocus. Chole means bile, so choledocus. Okay. Now, the sphincter that surrounds the pancreatic duct is sphincter pancreaticus. Okay, and the sphincter that surrounds the hepatopancreatic duct, it has bulged to form an ampulla, so it is called as ampulla of Vater. This is ampulla of Vater, V-A-T-R, and this ampulla of Vater is surrounded by the sphincter, that is sphincter of Oddi. Okay, this opens into the duodenum, that to second part of duodenum at major duodenal papilla. So all this part is the extrahepatic biliary apparatus. Now in the extrahepatic biliary apparatus, first let us learn about the gallbladder. This is the gallbladder. So you can see gallbladder is a pear-shaped organ. See, it is a pear-shaped organ. The capacity of gallbladder is 30 to 50 milliliters. What does it do is, it concentrates the bile and then discharges the bile to the duodenum whenever we eat the fatty food. Where is the gallbladder located? Gallbladder is located in the fossa for gallbladder of the liver. Yeah, here. This is the fossa for gallbladder. So, this gallbladder is located in the fossa for gallbladder which is present in the liver. It is located along the right edge of the quadrate lobe of the liver. So here it is the one, this is present here, this is caudate lobe, this is quadrate lobe. it is present to the right of the quadrate lobe of the liver. And then it extends from the right extremity of porta hepatis to the inferior border of the liver. Liver has an inferior border, this one too, extends up to the inferior border of the liver. It is attached to the liver substance by a connective tissue. And this has various venous communications in the connective tissue. Okay. Now the dimensions are 10 centimeters is length is 10 centimeters and width is 3 centimeters. Okay. Now the parts of the gallbladder. Let us see the parts of gallbladder. Sorry, this one, yeah. Gallbladder is now divided into the following parts: fundus of gallbladder, body of gallbladder, neck of gallbladder. See here, the fundus of gallbladder is this one. This is the fundus of gallbladder. So what is the fundus of gallbladder? Fundus is the blind-ended, expanded part of an organ. This projects beyond the inferior border of the liver and it touches anterior abdominal wall at 9th costal cartilage. Here there will be the 9th costal cartilage. So it touches the inferior border, it touches the anterior abdominal wall just at the level of 9th costal cartilage. So now it is completely surrounded by peritoneum, okay, and it is related to anterior abdominal wall anteriorly, and posteriorly you will be having transverse colon. So if you want the relations, you can see this one clearly. Posteriorly you will be having the transverse colon, anteriorly it is related to anterior abdominal wall. So this is the fundus of gallbladder. Next, what is there? This is fundus, it is completed. And now the body of gallbladder. Body of gallbladder is directed upwards and then backwards. And it joins with the neck in order to form the complete gallbladder. This, where does it join at the neck? With the neck. It joins with the neck at the right end of porta hepatis. So here, it joins with the neck. Okay. Now, the upper surface of it is directly related to the liver. You can see the upper surface is directly related to the liver. The anterior surface of the body is directly related to the liver, whereas the posterior surface is covered by peritoneum. So the anterior surface of the gallbladder is directly related to the liver, and it is not covered by any peritoneum. But the posterior surface is totally covered by the peritoneum. So you can see this posterior surface is totally covered by the peritoneum, and this posterior surface is mainly related to the second part of duodenum. You can see the second part of duodenum here. So the posterior surface of body is related to the second part of duodenum. Now the neck. The neck is the upper end of gallbladder. It is continuous, that means the body continues with the neck, and this neck joins with the cystic duct so that the concentrated bile can go from the gallbladder into the cystic duct and then into the common bile duct and then into the ampulla of Vater. And now this, neck is attached to the liver by loose areolar tissue. And this neck, that to the posterior medial wall of the neck, this wall is bulged to form a pouch-like structure, and this is called as Hartmann's pouch, which is the most important feature of the neck of gallbladder. Okay, this is Hartmann's pouch. Okay, this Hartmann's pouch is directed downwards and backwards. The gallstones might be lodged in this Hartmann's pouch. And then what is there for the neck? The neck then continues with the cystic duct, which then continues with the common bile duct and then with the ampulla of Vater, and thus it helps in the entry of it. So if you see the relations, as I have said, the anterior surface of the, what is this? This is the fundus. It's related to the anterior abdominal wall and 9th costal cartilage. Whereas the posterior surface is related to this transverse colon. The anterior surface of the body is related to the liver and it is not covered by the peritoneum, whereas the posterior surface is covered by the peritoneum and it is related to the duodenum. And with the neck, if you see, the neck is connected to the liver by areolar tissue, and this neck has a Hartmann's pouch mainly. So all these are the relations of the gallbladder. So now, after completion of relations of gallbladder, let us now see the arterial supply venous drainage of the gallbladder. Okay. First, let us see the arterial supply of the gallbladder. This is the celiac trunk, which you can see. Celiac trunk gives common hepatic artery. This is common hepatic artery. Common hepatic artery is divided into two parts. One is hepatic artery and right gastroepiploic artery. Okay, right gastroepiploic artery, if you listened or learned the stomach lecture, then you can see this right gastroepiploic artery which runs along the greater curvature of the stomach and it anastomoses with left gastroepiploic artery. So this common hepatic artery gives two branches, hepatic artery proper and right gastroepiploic artery. This hepatic artery proper then divides into two branches, that is right and left hepatic arteries. This right and left branches of hepatic artery go to the right and left lobes of the liver and they supply there. But for the gallbladder, the right hepatic artery gives a small branch to the gallbladder. It goes like this and this supplies the gallbladder. And this is cystic artery. Got it? The cystic artery supplies the gallbladder. Similarly, if you come to the venous drainage, the cystic vein drains the blood from the gallbladder and then it drains into the portal vein directly. Portal vein directly. Okay, the cystic vein now drains into the portal vein directly. Okay, cystic artery and cystic vein. Cystic artery, it is a branch of right hepatic artery, whereas cystic vein, it drains into the portal vein. And now, what will you learn about? You will be learning about the lymphatic drainage. Now, if you see the lymphatic drainage, there will be cystic lymph nodes. All these here. There will be cystic lymph nodes. The cystic lymph node of Lund is the most important among all them and it is located in the Callet's triangle, which we will be learning later. Okay, this is the lymphatic drainage. And if you see the nerve supply are from sympathetic nerves. The sympathetic nerves are from here T. And let me change the color. It's just boring if you use the same color again and again. It's just from T7 to T9. Sympathetic plexus are from T7 to T9. Okay, all this is about the gallbladder. Now we have completed the gallbladder. Thus, this is the first extrahepatic biliary apparatus which we have completed. After gallbladder, the bile from the gallbladder goes into the cystic duct. So let us see the cystic duct now. This is the cystic duct. You can see here. This total is the cystic duct. This cystic duct is about 3 to 5 centimeters in length. Okay. It runs backwards and then downwards from the neck of the gallbladder and then it runs in the lesser omentum and then combines with common hepatic duct to form common bile duct. And here this cystic duct joins the common hepatic duct at acute angle. And now the cystic duct, if you see the cystic duct, the mucous membrane of the cystic duct, which is interior, it is folded into a number of folds and this forms spiral fold or spiral valve of Heaster. The spiral valve of Heaster keeps the duct open so that the bile can easily pass in and out of the gallbladder. When the common bile duct, which is here, when it is closed at the inferior end by that sphincter choledochus, then the bile which is secreted by the liver fills into this, it enters like this, and it fills the right and left hepatic ducts, and then it fills the common hepatic duct, and then it fills the common bile duct. Because of closure of sphincter here, the bile cannot enter from common bile duct into the hepatopancreatic duct. So what does this do? This total area is filled, but bile is secreting still. So the secreted bile now goes to the cystic duct, and then it reaches the gallbladder. And in the gallbladder, the bile is concentrated and it is filled. And now, when the bile duct is open, the bile flows from the hepatic duct and this one from the cystic duct and the common hepatic duct into this common bile duct. And from the common bile duct has this sphincter choledochus is open. So as a result, the bile can flow into the hepatopancreatic duct and ample of water, and then it enters the duodenum. So this is the main thing that you have to learn in cystic duct. Cystic duct, the main thing that you have to remember is the spiral valve of Hester. The spiral folds which you find here are the spiral valve of Hester. And the next one and the final one which you are going to learn is, because the cystic duct now opens into the common bile duct. So this is the common bile duct. Today I didn't use orange. Okay, yeah. So now this is the common bile duct. This common bile duct is usually 7.5 centimeters in length and 6 millimeters in diameter. Diameter is just millimeters. Yeah, it should be very small, right? And now parts of this bile duct or common bile duct. You can see this is what is this? I think you can easily guess. It is duodenum, right? So now the bile duct which is present above the duodenum, this part is supraduodenal part, which is present behind the duodenum. This is present behind it. I mean, first duodenum is present superior and this bile duct is inferior. So this is retroduodenal part, and that present below the duodenum is infraduodenal part, and that which is present here inside the duodenum is intraduodenal part. Okay, I think you now got it a little clear. So this is supraduodenal part, this is retroduodenal part, and this is infraduodenal part. Supraduodenal part is just 2.5 centimeters long, and it descends in the right free margin of lesser omentum to the right hepatic artery proper and anterior to the portal vein. It descends anterior to the portal vein, this common bile duct. And then the retroduodenal part, which is behind the duodenum. So what is its relation with the duodenum? It is behind the duodenum. And all the three, behind all the bile duct, there will be the inferior vena cava, which is running behind the bile duct. It is behind the bile duct. If this is the bile duct, if you see, and here this will be inferior vena cava. That is, bile duct will be superior and inferior vena cava will be inferior. So this behind the bile duct you will be seeing inferior vena cava and posterior aspect mainly. So here retroduodenal part, duodenum will be superior, and on the posterior aspect you will be finding the bile duct. And in the infraduodenal part, it runs in the groove between the upper and lower parts of posterior surface of pancreas mainly, and anteriorly, here you will be finding the pancreas. Superior relation is pancreas and inferior relation is inferior vena cava. Okay, I think you got it now. The thing is, in the supraduodenal part, superiorly, you can see the artery going, hepatic artery proper, and inferiorly you will be seeing inferior vena cava. And in retroduodenal part, you can find superiorly duodenum and inferiorly inferior vena cava. Whereas infraduodenal part, superiorly you can see the pancreas and inferiorly you can see the inferior vena cava. Whereas in the intraduodenal part, it's nothing but the intraduodenal part is the common hepatic duct joins with pancreatic duct to form hepatopancreatic duct. This hepatopancreatic duct opens into the into the second part of duodenum at major duodenal papillae, which is 8 to 10 centimeters distal to the pylorus. So now it is here. So this is intraduodenal part. So all this is the duodenum. All this is the common bile duct. Now the final small thing which I wanted to share with you is the cystohepatic triangle of Callet. What is it? Cystohepatic triangle of Callet. So what is it, first of all? So now, if you see, let me draw a liver first. This is the liver, and this cystohepatic duct, so this is gallbladder, okay, and this is, what is it? Cystic duct, and it joins with hepatic duct, common hepatic duct, to form common bile duct. That's what's happening. And if you see the artery, this is right hepatic artery, left hepatic artery, both combine to form common hepatic artery. Okay, now, where is the Callet's triangle? First, I'll say the boundaries. You can easily find out the Callet's triangle with the most easiest way. So let's start. Where's my pink pen? Yeah. Now, let us start it. First, on the right side. So this is left, this is right, right? On the right side, we'll be saying the cystic duct. Where is the cystic duct? This is the cystic duct. Okay, this is the right boundary. Right is cystic duct. And what is on the left? Left is common hepatic duct. This is left common hepatic duct. Okay. What is inferior? Inferior is nothing but the lobe of liver. Inferior surface of liver. So this is Callet's triangle. What is present in Callet's triangle? Mainly the Callet's lymph nodes are present in the Callet's triangle. This lymph node is called as cystic lymph node of Lund. L-U-N-D. So this is cystohepatic triangle or Callet's triangle. Okay then, bye.